Personality disorders and types. Definition: people who have maladaptive behavior patterns are said to have personality disorders. Types of personality disorders. The first one is paranoid personality disorder. This is seen in people who are irritable and suspicious. They expect that they are mistreated by others and thus become secretive and look out for possible signs of abuse and trickery. These individuals are extremely jealous and tend to blame others even when they are at fault. They are sensitive, quick to take offense, tensed, and argumentative. For example, people who assume that their neighbor's dogs deliberately barks in the morning to disturb them. The second type is schizoid personality disorder. This is seen in people who have difficulty in forming social relationships and therefore they have few close friends. They appear dull and aloof and without warm or any tender feelings for others. They are indifferent in terms to praise, criticize, and sentiments of others. They are loners and pursue solitary interests. The third type is schizotypal personality disorder. These people have interpersonal difficulties of schizoid personality. Schizotypal personalities have magical thinking, that is, superstitious beliefs that they can foresee the future, and telepathic and recurrent illusions. They may see a presence of force or a person that does not exist. Speech may contain words used in unusual and unclear fashion. Behavior and appearance may be different and delusions are common. The fourth type is borderline personality disorder. It refers to instability in relationships, moods, and self imagination. For example, attitudes and feelings may vary considerably. In borderline personality disorder, emotions may shift to anger. They are argumentative, irritable, sarcastic, impulsive, and unpredictable. For example, they may be involved in gambling, eating sprees, and may be self damaging. They cannot stay alone. The fifth type is histrionic personality disorder. This is seen in people who are overly dramatic and always drawing attention to themselves. They are manipulative, seductive, demanding, and constantly depend on others. Their speech is vague and impressionistic. The sixth type is narcissistic personality disorder. These people have grand views of their uniqueness and abilities. They are preoccupied with fantasies of great success and they crave attention of others. They lack empathy and have feelings of envy by taking advantage of others. That is, by expecting others to do special for them and they do not reciprocate favors towards others. The seventh type is avoidant personality disorder. These people are highly sensitive to possibility of social rejection and humiliation. Therefore, they are reluctant to enter into relationships even though they want closeness and affection. They suffer from low self-esteem and devalue all their achievements. There is slight overlap between avoidant and dependent personality disorder. The eighth type is dependent personality disorder. They lack confidence and self reliance, allowing others or their spouses to decide where they should live, what jobs they should do, with whom they should be friendly. They are inferior to their own needs to ensure they do not break up relationships they have established. They are sensitive to criticism, disapproval, and devastation. Women are more prone as compared to men. This is also called as the inferiority complex. The ninth type is obsessive compulsive disorder. They are perfectionists, preoccupied with rules, schedules, and details. They are work rather than pleasure oriented and have difficulty making decisions. They demand everything to be done their way, hence, they have poor interpersonal relationship. They are formal and serious and less warm and friendly. Men are more prone rather than women. The tenth type is passive aggressive personality disorder. They resist demands of others in social areas and work. They are stubborn. They are habitually late to work or for appointments. They procrastinate and forget. This leads to no promotions in work and leads to problems in married life. This involves a hostile way of controlling others without assuming responsibility of their own anger. The 11th type is antisocial personality disorder. This is a dominant diagnosis seen in sociopaths and psychopaths. They always break rules and regulations. They indulge in maladaptive behaviors, for example, drug dealers and murderers.